Hello, my name is Alexa Clare Anderson, and I am taking a class called The Pandemic, Science and Society through Washington University in St. Louis. Today, I would like to share what I have learned about how SARS-CoV-2 is affecting mental health across the board. COVID-19 has negatively impacted people's mental health for a number of reasons. The first is that people are social creatures, and it is not natural for them to spend time alone. Other reasons include the fear of dying from COVID-19, a loss of control, grief from loved ones passing away, and the decrease in available entertainment. The mental illnesses caused by the pandemic vary from person to person. Among these are anxiety, depression, substance abuse, OCD, agoraphobia, which is a fear of leaving the house, and PTSD. PTSD is especially prevalent in healthcare providers and people who have been very sick with COVID-19. Certain groups' mental health is disproportionately affected by COVID-19. Among these groups are essential workers, caregivers, and those who are isolated. Mental health issues are also exacerbated by cultures that have a stigma around mental health and marginalized groups that cannot access mental health care. Elementary school children are experiencing unique challenges in the face of COVID-19. All of their favorite parts of school, such as recess and playing, are gone. Children report that this is very stressful for them. Also, sitting in front of a computer for extended periods of time is difficult and unhealthy for younger kids. Finally, online learning is not as effective for children as it is for older students. This makes it more challenging for them to reach educational milestones, such as learning to read by the end of 3rd grade. Starting in 4th grade, kids need to be able to read so that they can learn. Therefore, not reaching a milestone has future consequences. Like elementary school children, LGBTQ+ individuals have their own challenges. One issue is the lack of data on LGBTQ mental health. This makes it difficult to understand the issues that they specifically face. Furthermore, the in-person Pride celebrations were canceled this year, making it more difficult to form a sense of community. Also, LGBTQ people were already experiencing higher rates of mental health issues and social isolation than others before the pandemic. COVID-19 has only exacerbated these issues. Although this is a difficult time for everyone, there are things that you can do to protect your mental health. First of all, it is important that you take care of yourself physically. Create and stick to a daily routine. Make sure that you get 7 to 8 hours of sleep a night. Eat in a way that is healthy for you. Stay hydrated. Find ways to safely leave your house. And exercise. Also, make sure to take part in activities that make you feel fulfilled. Try meditating through apps like Headspace. Foster safe connections with your loved ones. And do kind things for others. Also, remember that you do not need to be happy all of the time. It is healthy to acknowledge your struggles and seek help when you need it. You can help others during this stressful time. If you notice that your friend is failing to complete their daily activities of living, such as eating or showering, withdrawing from safe social situations, or abusing substances, they might be suffering from mental illness. There are resources for people who are struggling. Among these are seeking help from a medical professional, the Substance Abuse and Mental Health Service Administration, and the Trevor Project. I would like to thank and extend credit to guest lecturer Dr. Colin Innes for this presentation. My icons are from Flat Icon, an extension for Google Slides. The names of the icons are listed below, and their attribution is at the bottom of each slide. I also used Google Slides to create the presentation and made a screen recording through the program Screencast-O-Matic.